George, do you do New Year's resolutions?
Yeah, but it's been the same one for the last 63 years and I've never managed to fulfill them.
What is it? Get healthy.
But yeah, I'm getting healthier, read more widely, spend more time with family and friends, all the basic ones. And every year by about February, it's like, okay, well, next year for sure.
Hello and welcome to Pulse, your podcast delving into all things health, innovation, digital and data, proudly brought to you by Pulse+IT News. This is part 2 of our 2025 Pulse+IT Year in Review series. And I'm your host, Louise Shaper.
And I'm your other host, George Margellis.
George, this episode is gropping between Christmas and New Year, but sorry, guys, to give you a look behind the curtain, but George and I recorded this before Christmas, so I can't ask George with any insincerity, how was his Christmas? But you'll be hearing this after Christmas. But I can ask you, George, what your New Year's plans are.
Well, look, so as we've discussed in the last podcast, there's a bit of a pallor on Sydney at the moment after the Bondi issue. So we haven't really quite worked out what we're going to do yet, but hopefully we'll get a chance to catch up with some friends and family. It'll be Evie's first Christmas coming up and then Evie's first New Year. So I think we'll be spoiling her rotten, basically, will be our main activity.
Nice.
How about yourself, Louise?
I'm coming to Sydney for New Year's. So I was invited to a party and I was like, that sounds fun, with a friend of mine, but I haven't met his wife or his children or his friends. He'll be the only person I know and he'll be the host, so he'll be very busy. But I'm looking forward to an opportunity to meet new people and come to Sydney. I'm only coming down because I've got my mum here, so I'm only leaving her for one night. I actually haven't told her that yet, but anyway, sure, I'll tell her before Christmas. But anyway, so I'm going to this party and I was like, I'll just stay in the normal places. I stay usually like Ridges level hotels, so not crappy hotels, but not super nice ones, but just comfortable. And anyway, I've never spent more than $350 a night, and I like spending $200 if I can. But Sydney's quite expensive for hotels. But anyway, $350 is the most I've ever paid in Sydney. To spend one night on New Year's Eve in Sydney, it's like $1,500.
Ouch.
I know. I was like, what? And then I actually had a look at a backpackers because I was like, how much do backpackers charge? Maybe I'll just do that. Anyway, for a shared room, like typical backpacker stuff, where you get no privacy, no storage, you're sharing a room, just a single bed, $400 a night.
Oh my God.
So I was like, do I ring George and ask to crash on his couch? But I ended up thinking, okay, well, maybe I just will stay at the party really late and then after the party, go see friends when the sun's up.
24-hour partying, exactly.
That's right. I'm like, he's got teenagers. So I'm like, I'm sure the party will go all night. But I found an Airbnb that's only like a 20-minute walk. But it's a new listing. So I should give you, George, my phone number and check in with you.
Yeah, definitely.
Because I might need an emergency contact because it's a new listing, so no reviews. And I've only ever stayed in Airbnbs where you've got the whole place to yourself. But this time I'm just in some guy's spare bedroom. So I'm having an adventure. I'm starting 2026 off with taking a few risks, but having some fun, hopefully.
I hope it all goes well. You do have my number if you do need anything. And we do have spare couches here, so.
Oh, good. Thank you. That's very sweet, George. And George, do you do New Year's resolutions?
Yeah, but it's been the same one for the last 63 years and I've never managed to fulfill them.
What is it? Get healthy.
But yeah, I'm getting healthier, read more widely, spend more time with family and friends, all the basic ones. And every year by about February, it's like, okay, well, next year for sure. How about you, Louise? Are you a resolutions person?
I used to always kick off January with a diet, not about losing weight, but just to do an extreme thing. But I don't do that anymore because, over a decade ago, I decided I'd done the quit sugar thing and other stuff. And I was like, oh, no, I'll be a vegan for a month because, man, that's hardcore. That's extreme. Anyway, and my body responded so well, I kept being a vegan. So now I just eat the same stuff. But I think this year I do have the healthy thing like most people do because I've got to, stop prioritizing working all the time. But one of the things that I want to spend more time in 2026 is actually be in Sydney more often. I have so many friends, yourself included, obviously, George, in Sydney. So I need to find a role or a board position or something that gives me a work excuse to come to Sydney regularly and then I can catch up with more people. So I want to have more fun and have more people in my life instead of working all the time. So that's my 2026 plan.
I know we do have the big healthcare week coming up in March that Pulse+IT is actively involved with, so we'll have you up for that. And not to say Sydney's a better city than Melbourne, but Sydney's a better city than Melbourne.
Well, I just don't think I could afford to live in Sydney. But I love Sydney. But I don't have the whole rivalry thing because even though I've lived in Melbourne for 15 years and it is home, but, WA is always going to be home. Like I still, especially with the weather, like yesterday I was wearing a jumper and it was so cold in Melbourne. I had to go get a jumper. I refused until about 11 o'clock in the morning. I'm like, this is ridiculous. I'm just sticking with a T-shirt. But then I had to relent and go put a jumper on. It was just getting too cold. Yeah, your weather is so much better in Sydney, that's for sure.
Yes and no. Last night, I think it was 34 during the day and it was about 29 during the night. So we were sitting there under fans. So it has its pros and cons.
Oh, I like the heat. And George, just before we get started with the topics we're going to go through today, I just wanted to give a shout out for any Pulse Pod listeners who might be jazz fans. Are you a fan of jazz, George?
Don't mind some cool jazz in the background?
Well, that one time that you actually took a proper holiday and didn't podcast from overseas somewhere, when Mike Bainbridge came on the show. So a friend of the pod, Mike Bainbridge, who now is based in the UK. So unfortunately, we've lost him from Sydney. So he does the audio engineering for a jazz singer from Australia called Greg Arthur. He's a jazz singer and songwriter. I think of him as a bit like the Michael Bublé of Australia. And he's got a TV special and it's coming out on SBS and SBS On Demand on January the 1st. So if you're at home, nursing a bit of a hangover or just wanting to chill, turn on SBS on the 1st of January because not only is Greg a really talented singer, but the audio engineering, the whole thing was put together by Mike. So well done, Mike Bainbridge. I'm looking forward to seeing his name in the credits and listening to what he pulled together.
Wow. I remember going and visiting Michael at his house and seeing all the equipment he had set up there. So he was really into it. And
Yeah.
I have to admit, I do miss Mike. He was lots of fun to catch
Me
up with.
too.
And hopefully he's having a great time over there in the UK. And we'll keep in touch with him.
Yeah, he is. Absolutely. All right. Shall we get into today's format of the show, George?
Let's knock off 2025.
Okay, let's do it. For anyone who didn't hear the previous episode, last week we introduced the new series that we're doing to wrap up the year, which is an overview of Pulse+IT's 2025 Year in Review series. Last week we focused on Australia and New Zealand happenings. Today we're focusing on allied health and community and aged care. So there is heaps to cover, from foundational strategies, groundbreaking technologies that are reshaping care delivery nationwide, digital uplift plans, to the crucial role of AI. Sorry, we are going to have AI again because that's the rule, apparently. So the crucial role of AI in supporting an overstretched care workforce. All right, first up, our first segment I've entitled Aged Care's Digital Reckoning. So for Australia's aged care sector, 2025 was dominated by preparations for the most sweeping set of reforms in over a decade. The new rights-based, person-centred Aged Care Act 2024 came into force on November the 1st, replacing the previous legislation and aligning with the launch of the new Support at Home program. Policymakers and providers alike moved towards digital implementations to ensure a smooth transition. George will have no doubt a lot to say about how smooth it actually has been. The government stressed that ongoing digital reform was needed to support the Act, noting that digital systems already underpin business processes for providers and deliver services to over 1.5 million older people. Key system changes went live on day one, including the new Government Provider Management System portal and mandatory use of the Integrated Assessment Tool classification algorithm. However, sector leaders have repeatedly stressed that digital foundations, particularly interoperability, were a major challenge and still are a major challenge. Early in the year, calls for up to $600 million in ICT investment underscored the scale of what was needed to achieve compliance, as many providers face significant variation in digital maturity and financial viability challenges. Now, George, I gather it is unlikely that providers will be able to harness the opportunities technology offers without this financial support. Given the sector is generally financially struggling, what's the word on the street within the sector? And you'll have no doubt a lot to say on this story.
How much time do we have, Louise? This has obviously been my bread and butter for the last 6 years as I've been involved with the Aged Care Industry Technology Council and now with Ageing Australia. But first of all, I'd just like to comment on the end-of-year reviews that the Pulse+IT team have done. I think they've done a really good job this year by really capturing the essence of the stories, but also by having multiple topics, including aged care and allied health, as separate stories. That shows that they understand what healthcare is all about. It's not just all the whiz-bang gadgets in the hospitals or the latest and greatest research, but the on-the-ground implementation of solutions that's important. I went through the various opinion pieces that they started publishing every week towards the second half of the year. I thought that was really interesting as well. Although I did note that the photo of me from the ITAC conference, I definitely needed a haircut. So next year, remind me, Louise.
All right. If Marina doesn't nag you enough, I will join the chorus.
This is a big topic. Aged care has been something I've been focused on now for well over a decade. It was one of the things that we really focused on when I was at Intel, and having spent 6 years as chair of the Aged Care Industry Information Technology Council, we've been actively involved with it. And there is a history here, so I will touch briefly on the history. Back in 2019, the council was asked to do a review of the IT capacity of the aged care sector, and shock, horror, surprise, our report said that it was struggling. It really didn't have a strategy. It didn't have a plan. It didn't have standards. It didn't have the skill sets internally. It was picking and choosing pieces of technology ad hoc and trying to get them to work together. And the biggest challenge was, of course, that the government departments that they reported to were also somewhere back in the 20th century. So they really had archaic reporting systems which required, for example, comma delimited files to be uploaded in small chunks because they could only be handled up to a certain size.
Then that's a problem not just of the providers, that's a problem with the department then.
Absolutely. That was the limiting factor, that even if you did something whiz-bang out in the sector, your reporting requirements. So one of the things that came out of the Care IT report, as that report was known, was that providers were spending up to 100 hours a month fine-tuning their data via various reporting modules to be able to upload it as required to the department. And the biggest challenge was, of course, that the data was in such a bizarre format that it wasn't usable for innovation, it wasn't usable for quality improvement. And that really highlighted the big challenge we faced. So look, I won't touch a lot on the reforms. The reforms themselves came into effect on the 1st of November. There's lots of discussion happening in various forums about their effectiveness. I think we have to give them some time. They've really only been around for less than 2 months, and there will be some changes going forward. But the reality is the infrastructure upon which these reforms were based was our biggest challenge. And that's where the departments came to the forefront and decided that they really needed to update that system. So first of all, a call out to who was the then new First Assistant Secretary, Faith Lavaris, who was one of our early guests on our podcast.
Yes. Yeah.
She came in and implemented a major technology reform within the department and bringing it up to modern standards. Things like APIs, which didn't exist back then, cloud-based infrastructure, which didn't exist. My understanding was that most of the systems were running on 30-year-old IBM mainframes that were sitting in a basement somewhere. So that implementation of new technology was a game changer. There's been some discussion about the costs and the selection of products. The reality was we were going from 1960s, 1970s technologies to 21st century technology, and that was a challenge. The key thing here, of course, was that the aged care providers and the software vendors had to go along on the journey with them. And to the department's credit, they did a really good job in keeping us all informed about what was happening. So Faye used to have every 6 or 8 weeks a thing called the Tech Talk, where we spent an hour and a half to 2 hours talking about the changes that were underway. We would have access to the roadmap. And every 2 weeks, there was a more detailed sector meeting where we actually went really into the nitty-gritty and did a lot of co-design. So from that perspective, there was a lot of communication between the department and the sector, but it was a massive change. We're talking revolutionary change. And we saw that hit the aged care providers. You touched on the $600 million request. That was something that Ageing Australia put in their budget request for 2025. We didn't get it, and understandably so, because there was quite a lot of money had been spent on other parts of it. But the reality is there is a need for support for the sector to be able to implement these changes. Now, the changes are in place. Is money the only thing we need? No, I mean, money is important, and I agree. We need to understand how we do that. And there's been some toing and froing with the department around that. But the big thing missing in the sector, in my view, is digital maturity, knowing how to implement solutions effectively. And I think that's where the real secret sauce for success is.
So is that like workforce related? You start with workforce?
Absolutely. Workforce is the key issue, not just your technology workforce, which is critical, having people in your organization who understand the technology, but also having people in your organization who can then train the rest of the workforce to fully utilize the capacity that they have, understanding what's coming around the corner, be that AI, be it fire standards, be it robots, but understanding how you adapt your organization to utilize those new technologies. It goes all the way up to the board level, having an understanding at a board level perspective of what the role of technology is in your organization. It's not just there to capture the numbers or to meet the compliance requirements. It's a tool for quality improvement, for safety management, for delivering higher quality care. So a lot of it comes down to building internally within these organizations a culture of data first, high quality data. Now, one of the key things that's happened here, of course, is that I touched on how Faye Flavaris was involved in getting digital transformation in aged care. This year, she got promoted to the role of Chief Digital Information Officer across the entire Department of Health, Aged Care and Disability. So for the first time, we actually have an overarching program around health, aged care and disability, following people through their journeys through the various parts of the system. So I think that's really important that we're now starting to think about integrated care more effectively as a core requirement, and data being one of those key things that ties it all together.
That's a really good point, because one of the things that we do so well in healthcare globally, data silos. Listeners to Pulse mostly would understand why it's so difficult to break those data silos, and it's got nothing to do with technology, but it's got everything to do with accountability, responsibility, and who's going to spend what money. Because if you improve your system, great, but you're probably not going to get the benefit as the facility. The next person in the line of continuum of care would get the benefit, and of course, always it benefits the patient, or in this case, the resident, or actually, what are we calling them now with the new act?
Participants.
Participants, that's right. Okay, still have to get used to that word. But anyway, but to have Faye in a role now where she's actually responsible for multiple parts of the healthcare system, then it's now her job to make sure that data does flow throughout it, not just look at them as each individual silo.
Absolutely. Look, we've been saying for years, if not decades, how fragmentation of our healthcare system is one of the greatest challenges we face, and digital fragmentation makes it even worse. So having an overarching digital information officer, I think, is a great step. Not to put too much onus on Faye, but I'm sure we will need to think about the whole end-to-end patient journey from birth to grave. We have a national personal health record in our My Health record, which is a great backbone, but we need to deliver more upon it. And I think that's where 2026 will be the year where aged care can really thrive through digital transformation. But it goes back to that person-centered care. The reality is, as people enter aged care, they come from healthcare, they come from maternal care, they come from childcare. So there's a continuum of care. How we make sure the data follows that person is important. I've got to give the shout out here to the team at Pulse+IT, who have done a great job in keeping us up to date. And I think we'll continue to keep our eyes on what's happening in that space. But we need to also be very active as health consumers to point out what we want from the system. And I think that's where we really need to work closely with the departments. We still have state and federal departments, so we still have some fragmentation, but hopefully they can get their act together and deliver us a end-to-end, high-quality, safe, effective healthcare system that's digitally enabled in Australia.
Yeah, so important. And George, what are your thoughts? The idea of having digital front door to aged care, is it broken or is it just non-existent? And this is purely anecdotal, but at Aging Australia's conference this year, I met people who were talking about these issues and educating me. And I just seem to know so many people, dealing with parents with dementia. And so many people I know are starting to deal with these issues. And so for the first time, they're having to navigate and support their parents and loved ones to they now need some level of aged care support, whether that's at home or they actually do need to relocate into a facility. And just everyone's story. No one has told me, there was a lot of grief and it was really hard emotionally, but the system was so supportive and people were great. Every story is a nightmare. And I just can't believe we're not using technology to do this. And just last week we had stuff in the news, which happens all the time, older people being kept in hospital for longer than they're required for medical purposes because they have to be discharged into aged care and there's no aged care bodies. And then meanwhile, we've got hospitals just sending out emails, no system, just sending out emails or making phone calls to local aged care facilities to see if anyone's got a bed. And yet there are solutions around that actually address that, but we're not using them. Are you confident that with the new act and the new support and everything that these things will start to be rectified?
So if you look at the vision of the aged care digital plan, concept of a single front door is part of it. The challenge is, of course, is that single front door needs to connect to multiple other systems. And we're just now bringing those other multiple systems up to speed to making them interoperable. It's on the roadmap. I think it's something that we really need to focus on because you're right. I have multiple family members and friends who have met the challenge of trying to get someone into the aged care system, even though that person may already have a presence in the healthcare system. Bringing him into aged care is like a whole new journey. And we saw things like the new assessment program, which makes it even harder for people to get in. Whereas people have been continuously assessed during their lifespan, their GP, if anyone, would have the greatest knowledge of what their current status is, but they don't feed into the system. So still a lot of work to be done. And again, I think we need to have co-design with the sector. And this is where things like AI can really play a role because there is now so much data becoming available that we actually need some ways of analysing in real time, but also some way of empowering those who are using the system. And that's where we've spoken with our friend e-patient Dave and Liv Salmo about the patient's use of AI. This is where the family and friends can actually start utilizing tools like AI to better understand what the options are, what is the best option for their loved one, and play an active role in getting them engaged to it. And the onus on the department to make sure that front door interoperable, easy to access, available. Equity is critical here. So I think we've still got a lot to go. So I don't see myself stepping away from aged care for a little while.
No, we need you.
Possibly I'll be sitting in a residential aged care facility in 20 years' time, still banging the drum saying, we're almost there. But I think we are going in the right direction, but it's a journey. And I think we need to accept the fact that sometimes we can't rush it. Sometimes I worry that when we do knee-jerk reactions, we put in a patchwork solution to meet the requirements before the next election and then pay the price of trying to then make it all fit in. Not necessarily slow, but continuous and steady improvement and co-design. This is where the workforce needs the education on how to interact with the technologists. So they're having those right discussions. This is where programs like the government's Tech Talk, where we actually have ongoing communication. And hopefully in the new year, I hope to see some new innovation forums come up, like what's happening now with doctors and the medical team, hackathons. This is maybe time for Aging Australia and other organisations to have innovation forums so we can look at what's next.
Yeah, that's a great idea. All right, I'll put my hand up for that. If Aging Australia wanted to do a hackathon, I'm up for that. Yeah, Greg and I did the RACGP hackathon earlier this year and it's been so successful. And even at the Seeker Lab event we had recently, the president of RACGP and the vice president showed up, and one of the teams that actually had participated in the hackathon, who's going forth and building the technology, forming a company and everything, they actually pitched. And yeah, it was great to have the RACGP there to continue to support it. And there's going to be another one in 2026. So yes, Aging Australia, I'm volunteering.
You and I have both been at this for a while now. And that is a game changer. 20 years ago, when we were having discussions around digital health, the concept that someone like the RACGP or any of the peak bodies would actually have a hackathon would have been anathema. So the fact that that's happening now, the fact that clinical entrepreneurs are starting up new organizations that are focused on deliverables, I think is a real positive.
It sure is. All right. Thank you, George. I apologise for the listeners who know that we could make this a 3-hour episode just on aged care, but at least hopefully we've touched on enough of it so it's valuable to you.
And if they do want a 3-hour episode about it, they can come and join us at ITAC in May in Brisbane, where we'll have 2 days on this discussion.
That's right.
And I'll have a haircut this time.
Yes, and that's in Brisbane?
That's in Brisbane, yeah, May 6 and 7.
Cool. Excellent. It's in the diary. All right. Let's have a quick break and we will be back with more in our 2025 Pulse+IT Year in Review series. Welcome back, everybody. Now we're talking about Allied Health's breakthrough year. So if aged care's transformation was mandated by reform, Allied Health was something entirely different. Allied health as a sector often has just not been prioritised and has been written off as a digital laggard. Well, 2025 was the year that Allied Health stood up and demanded better. And I'm here for it all. So in February, Allied Health Professions Australia released their Allied Health Digital Transformation Survey report. The report highlighted gaps in workplace readiness among professionals. The survey had almost 2,500 responses across 36 different allied health professions. It identified that the diversity of professional care settings, clinical areas and funding schemes made increasing the adoption of key digital products like My Health Record and e-prescribing challenging. And look, while that might be true, I do think this all comes down to Allied Health's history of being relegated to pretty low priority when it comes to the necessary infrastructure and support required to digitally enable clinical practice. It's a bugbear of mine. I literally studied that for my PhD and I discovered it wasn't the problem of the professionals or the individual clinicians at all. It was the system that did not support them. Anyway, I'll get off my soapbox now. Now, connected care, it just isn't possible without including allied health. And ARPA rightly called this out, as did Australia's Chief Allied Health Officer, Anita Hobson-Powell, when she was a guest on the pod back in July. And then the year ended with a banger, the launch of the National Allied Health Digital Uplift Plan by the Australian Digital Health Agency in December. Now, a heap of consultation made this plan possible. We're talking more than 220 allied health professionals were involved, 60 peak bodies, yes, 60, consumers, software vendors, government stakeholders. And the resultant 70-page report is a 5-year plan to ensure allied health professionals are not just included in the digital future of healthcare, but empowered to work seamlessly as part of multidisciplinary care teams. As the plan runs towards 2029 and onwards, I'm hoping there will be a lot of reasons for us to be discussing the progress of all of these things over the coming years, George. Now, Pulse+IT in their series to wrap up the year also covered a lot of innovation in allied health. There is so much going on with virtual services, apps, AI and other things, not just in Australia, but internationally. We also had many allied health professionals in our last Seeker Labs cohort. So allied health professionals in innovation and entrepreneurship is something I want to see more of in 2026. Now, George, we both started our careers as allied health professionals. Isn't this exciting to get to a point in time where allied health is finally seeing breakthroughs in digital health?
You're right, Louise. We both did start in allied health, and I must admit that one of my frustrations when I was working in allied health was the fact that it kept on being lowly prioritized in the whole healthcare delivery sector, in the whole model of healthcare. And one of the things I've really appreciated in my recent work with aged care is how important allied health is to not only improving outcomes, but improving quality of life and also just managing the wellness of people, not just the sickness. So as we talk about this now, sick care versus well care model, the reality is allied health is much better placed to manage the wellness of individuals and improve that capacity to stay well. And without it, we just see big gaps in the delivery of care. So the fact that allied health has their own chief officer now is a critical part.
Yeah, even that alone is great. And to have Anita, she's such a fabulous advocate.
Yeah, so I think that's really important. And the fact that we actually now have a digital uplift plan is critical. When we looked at what we did in Care IT, we saw exactly the same sort of challenges that we saw in the ARPA report. Lack of training, lack of resources, lack of capacity to innovate because there was no scope within their scope of practice for them to do something innovative. And that's why it's really exciting. And some of the work that Pulse+IT has highlighted, the innovations in allied health. To be honest, it had it not been for something like Pulse+IT, we wouldn't even know they exist because they just don't get the visibility that the latest cancer cure or the latest genomics research gets in the mainstream press.
Yeah. And George, even in their own publications, like years ago when I was doing my PhD, we called it eHealth then, but I offered to write a digital health column in the occupational therapy trade magazine that came out. And now that I know how nonprofits work, I get why they said yes, because I didn't expect them to say yes. But they're like, oh, someone offering work for free. Great. And so I did that because no one was writing about it. And we're seeing more and more, but there's still not a lot of allied health conferences that have a track on digital health. Although I did note that the national conference in allied health this year had lots of digital health content, and I was privileged to be asked to speak at it. So we are seeing changes, but there's still more to be done.
Well, look, one of the big challenges we faced in the past is even if there was any digital experience in an allied health sector, it was laser focused on the specific tasks they were doing. So using my background in optometry, we actually had some pretty good systems as far as capturing optometric information, which enabled us to improve the quality of prescribing from an optical perspective, but no way of sharing that information beyond our own system. So we had individual siloed systems in all of our practice, which enabled us to send information to the labs who were making the lenses, but we couldn't communicate that to the GP. We couldn't communicate that into the broader healthcare system. And often we would have to extract information from it to turn it into a letter to send to another healthcare provider. So there was no connection between them. And then forget the fact that when you look at someone's overall health, their physiotherapy component or the occupational health component or the speech therapy component, these were all fragmented pieces of information, which if you were lucky, ended up in a PDF file sitting in someone's folder on their hard drive. More than likely, it was just a bunch of letters that were scattered in people's drawers. So the idea of connected health without the main part of healthcare, if you look at the number of healthcare providers out there, whilst doctors and nurses like to beat our drum about how important we are, there are so many other healthcare providers out in the sector who we're just not connecting with. You can't have connected healthcare if you don't connect all the people in the sector. And this is where the onus now falls back on the allied health profession as well to make sure that they are developing systems that are interoperable, that using the up-to-date FHIR standards. And kudos to the people at FHIR. They have brought in allied health into those discussions early on as well.
Oh, and the agency has also funded vendors. They've incentivized vendors to actually get involved. Because I remember 20 years ago running around at HIC conferences and going, why don't you guys build stuff? Why aren't you building stuff for allied health? They're like, oh, the doctors are more important, then we'll get to allied health. I'm like, no, literally, look at my research. Start with allied health because they're just so grateful someone will do anything for them. You don't have to convince them. They're just grateful for the help. And here we are 20 years later.
I remember having a very similar discussion because I said, at the very least, now again, using my optometry background, being able to have your glasses prescription available on My Health Records, because if you're in the middle of nowhere and you break your glasses, a new pair of glasses requires you to have a prescription. And that was data that was digitally captured from day one.
And it's still not connected, is it?
Still not connected, no, yeah.
Okay, so I go to OPSM and they have so much cool tech, but it's all just isolated. I don't even know whether they upload it to a server. I think it might actually literally be in their physical building.
And it's interesting. And then you start looking at things like, there's been a lot of research recently about using retinal images for diagnosing and managing disease. So I've been capturing digital retinal images for 20 years, but it sits on their hard drive in their office and no one else has access to it.
Yeah, and I have had that done 3 times now, and so far so good. They're looking at the health of my eye, but they're not using it for all those other things, which other clinicians could if they could share it. And yet, when I talk to the optometrist, usually in an optometrist's office for a while, and I'm always bagging on anyone if they will listen about digital health, and I've never met an optometrist that doesn't want to be connected. They're just so keen.
And I think that applies for all allied health workers.
Yes.
People get into allied health for the right reasons. They want to provide care and they provide different types of care. We need to understand what those different types of care are and how they all interact to make a person's journey better. So I think we're at a very important stage here. The fact that we're doing this now is great. We need the allied health professionals to pick up their game and become more digitally aware of what solutions are out there and what's available and lobby for making sure they're part of the national health journey.
Yeah, absolutely. And just wanted to also give a big shout out to ARPA CEO Bronwyn Morris Donovan and Jackie O'Connor, who's the digital health lead at ARPA. Those two women, man, they are just tireless advocates. They've done so much work over recent years to get allied health a seat at the table. I remember when I first met Bronwyn, it was digitally, I think it might have been during the pandemic. And I was like, man, this woman is great. She's going to make sure people listen. And people are listening. And I also wanted to give a shout out to the agency because they've been prioritising allied health's digital enablement, not only with supporting the work that ARPA has been leading, but a whole bunch of other things, incentives for the sector. And really, they're just getting started because this digital uplift plan has a lot of work in it.
We're starting to see people with digital skills working their way up the structures and recognising the value of it. The challenge now is to deliver on that promise.
Absolutely. George, I'm looking at the time and you and I, we could sit here, I reckon, for another 2 hours. But what we're going to do is let's wrap now and then we'll give everyone a bonus episode that we weren't planning on doing until right now. Literally in real time, I'm thinking about this. So we'll give people a bonus episode that'll come out next where we'll have a part 3 of our year in review series. So let's wrap up the show there. But George, it really is clear that 2025 just has marked such a definitive turning point for allied health and aged care. Would you agree?
Yep, I think it's important that we've added the full components of what is involved in delivering care to Australia into the system. The mere fact that we now have a Department of Health, Aged Care and Disability, I think is a plus in itself, is a big move. We need to continue the journey, continue going forward. And I think that's where it's really important that, again, Pulse+IT keeps us up to date about what's happening in this sector, but people play a much more active role in calling for the changes that we need.
That's right. And that's what we will want to see more of in 2026 and beyond. That challenge is now shifting from we've well and truly proved the value of digital health for aged care and allied. And now we need to actually get to the business of ensuring that there are systems, not just technical systems, but actually process systems as well, that are supported and sustainable for all of aged care and allied health. And just imagine what they'll be able to accomplish, which is pretty cool.
And that includes things like research, things like real-time evaluation, all those sort of things that we had ingrained into the healthcare, into the medical care system, now needs to extend its way throughout the whole healthcare system.
That's right. If people want to dive deeper, yes, as George has reminded us, check out the Pulse+IT Digital Health Year in Review 2025 series on community and aged care and allied health. We'll put links to it in the show notes and really encourage you to check out Pulse+IT. There's just so much excellent content. I was reviewing some articles that I had missed during the year and was still learning new things. I was like, oh my God, I've missed a couple of these stories. And yeah, the quality of health journalism. It's such a wonderful thing to have an industry that actually has not just a trade publication type thing, but to actually have real quality journalism is just such a treat. Pulse+IT have been around a long time, but yeah, other industries don't have this. And I think we're so fortunate. And if you're just new to the sector, that's what I'd do. Get yourself a Pulse+IT subscription because everything you ever wanted to know about the history of digital health in Australia, they've been documenting it for a really long time.
Yeah, look, I think it's important, like I said, the year in review articles have been great. The weekly opinion piece I found quite interesting as well. And the fact that this is not built on hype, this is built on reality. The journalists have really done their homework and looked into the solutions that are out there and had open and frank discussions about what's working and what's not.
That's right. Okay, this next episode then will be a part 3 that we will still record in a moment. So for George and I in real time, but for all of you, you'll have to wait. And George, in the meantime, hopefully I might see you over New Year's then, since I'll be in Sydney briefly. We'll see what the Ubers are like in Sydney. Maybe not New Year's Eve, maybe New Year's Day though. And really wish you and Marina and the whole family, including little Evie, just a fantastic New Year's Eve celebration.
Thanks, Louise. Look, I'm glad you're going to be in Sydney. I really hope we can catch up while you're here. But I hope you have a great time at the party and views of Sydney Harbour Bridge on New Year's Eve sought after. So kudos for you for managing to get an invitation to a party overlooking the Harbour Bridge on New Year's Eve.
Yes, it was an invitation I did not want to say no to, hence why my mum is not going to have me around for New Year's. But anyway, I'll be back the next day. And of course, to all the Pulse Potties out there, have a fantastic holiday. We will be dropping this extra bonus episode and we'll have an episode or two where we're bringing up some fabulous content from the archives, some of the interviews that you may have missed from earlier in the show. But in the meantime, have a fantastic holiday and we will see you next year.
Thanks, everyone. And thank you for listening to Pulse, brought to you by Pulse+IT News. Pulse is produced by Ivan Jurek of Octopod Productions. Thanks to Emily Mara for her support. Big thanks to everyone for listening. Make sure you subscribe, follow and rate us wherever you get your podcasts. And visit pulseit.news to catch up on the news from Australia, New Zealand, Ireland and the rest of the world.